Hi, I'm Sarah Blanton. I'm a second year nursing student at Vincent University Jasper. I'm currently taking microbiology and we're learning about different things such as viruses. So today I'm going to tell you about a virus that is often considered so mild you probably wouldn't even notice you had it, but it could be dangerous enough that it could have serious, lasting, and sometimes deadly effects on unborn babies, and that virus is rubella. So, what is rubella? Well, it is a mild viral illness mostly that's caused by the rubevirus, also known as the German measles. It got the name German measles because while it's not related, it looks similar to the rash caused by measles. And rubella was also first discovered in Germany. It is also very contagious. It's spread through respiratory droplets, such as coughing and sneezing. So, therefore, it's very important to cover your mouth when you cough or sneeze. Make sure you're doing good hand hygiene, getting the soap on real good between your fingers, making sure you're doing it, um, at least 30 seconds and drying real well. Um, it is also very easy to spread. So, therefore, being in close contact in schools, crowded environments are a major risk factor for spreading it. So, it's important to avoid those if you suspect you have it, you have it, or someone in the group might have it, just to help prevent it from spreading to everybody. It's also considered one of the more serious risks to unborn babies if pregnant women get infected with it. And studies have also shown that rubella is one of the leading cause of preventable birth defects globally, especially in areas with low immunization coverage due to, just the lack of money, not able to get to a clinic that maybe has it, a more impoverished area. So now that we know what causes it and how it spreads, let's look at some typical signs and symptoms to watch for. So commonly you might get a low-grade fever, um, a headache, and sometimes mild pink eye. This can happen in either one or both eyes. You don't typically need to seek treatment for those, but you can. If it becomes very bothersome, you can go to your doctor and they might prescribe something for a few days. You also might notice like some swollen lymph nodes here behind the ears, maybe down here in the neck. Your doctor will probably also check for those too whenever evaluating you. That's just part of your body's way of trying to filter out this, what it considers a foreign uh, enemy, and help you get better. It can also be accompanied by a fine pink rash like this, which will start on the face. It'll begin to spread further down to the body, like over the abdomen, the back. You might see it some down the legs. Um, and this rash is also lasts about 3 days, and it is one of the reasons why it was given the nickname the 3-day measles. Um, some of the signs and symptoms for unborn babies or shortly after birth um, is something called congenital rubella syndrome. Um, the symptoms that go along with that is some permanent visual changes, like it could be total blindness, partial blindness, cataracts can develop. Uh, there's some brain abnormalities, so microcephaly. It can cause some mental retardation. Uh, it has known to affect the hearing, Again, this could be total deafness, partial deafness. Epilepsy is another one, which can be very serious. It can lead to death. It does affect different organs in the baby's system. Some of the main ones are the liver, the lungs, the spleen. So it's very serious when it comes to unborn babies. So, how do we prevent rubella or treat it if we have it? Well, currently, we don't have a specific antiviral treatment that targets rubella. So instead, we have to use supportive care. And this can consist of rest, fluids, and sometimes fever reducers if the fever gets high enough, maybe some anti-inflammatory if you're having a little pain in your joints or something. But the most important ones are getting plenty of rest, as your body needs to recover, and fight off this infection, and it does that best while we're sleeping. And staying hydrated, because you don't want your electrolytes dropping, and you ending up in the hospital having to get, IV fluids and rehydrated. So just make sure you're drinking plenty of water and getting plenty of rest. Now, for preventing it, we use a vaccine called the MMR vaccine because it's the most effective preventative method, and it protects against measles, mumps, and rubella. And it has also proven that when enough people are vaccinated, it can even help to protect those who can't get the vaccine by way of herd immunity. And so this vaccine is administered in 2 separate doses. The first one is recommended between the ages of 12 months and 15 months. And then a second dose is typically recommended between 4 to 6 years of age. And recent studies have shown that after being fully vaccinated, the MMR vaccine is 90% effective at preventing the measles, both in those who get the vaccine as well as others, because you're not exposing them to that virus. We went over a lot of information about rubella, so let's recap over some of the highlights and important things. So, rubella is a virus that typically just causes a mild illness. Like I said, most times people don't even realize they have it till the rash shows up. You might just have the low-grade fever and be over it. But then others, it affects them a lot more serious, especially unborn babies. Um, how it affects their brain. It can cause learning disabilities. It affects their heart. They can have an underdeveloped heart where it's just not pumping correctly, which can cause circulatory issues. It'll affect different organs like the liver and the spleen. It can cause epilepsy due to the brain malformation that it can cause, the blindness, hearing difficulties. So that is another reason why it is extremely important to understand what rubella is, how we prevent it, and take those necessary steps to do so. So we're not taking a risk of exposing these unborn children to it. Then we talked about how it's spread through respiratory droplets like coughing and sneezing, and why it's important to have good hand hygiene, getting between your fingers with the soap, getting underneath your fingernails, don't forget about your thumbs, go up to your wrists, making sure that you're using warm water and trying to do it for at least 30 seconds minimum, and then making sure that you're drying well. Um, not sending children to school if you suspect they have it or they have it, avoiding crowds, because it is easy to spread this virus. And like we've talked about, it can be very serious and have sometimes deadly effects for other people that might not be protected against it. And we talked about one of the best ways to prevent rubella is the MMR vaccine. It's been proven to be highly effective in preventing this virus. It'll prevent it in you when you receive it, and it helps to limit the chance of exposure to others that don't have it. Not everyone has access to healthcare. They might not have a clinic in their area that has it. They may live in a impoverished area. And so we don't want to expose them to something that they can't protect themselves against. So get those vaccines when you should, stay up to date on them, and take the necessary measures to prevent exposure to others. As we know, diseases like this, they can only be eliminated through proper vaccination and awareness. So make sure that you know all you can about these diseases that we're trying to protect against. So now, with all that in mind, I have a challenge for you. Know your vaccination status. Stay up to date with it. Don't skip them. Educate yourself on it, what it's preventing, how it's doing it, and all those important things. By doing this, you're protecting not only yourself, but all those who can't, especially unborn children.